My name is Christy, and I've been volunteering with HIPS for 3.5 years. I'm a maternity nurse. When I started out volunteering here, I was deeply disturbed by every death that I saw and every child. You want to save them. The healthcare system in Zanzibar is working hard to serve its patients, but it's really overloaded. So especially when you talk about maternal health and child health. Preterm birth is very common here, and certainly it's one of the leading causes of infant death. Just from the birth registry, I would see that a lot of babies have been sent home when they should have stayed longer, and most often they would be dead by the time I contacted the mom. That can be hard. As a nurse, you want to do everything you can, but you also realize that you're limited in what you can do.
Okay. Excellent. My name is Yuni Anselmus Pullen. I work here now for HIPS since last year, here in Makunduchi Hospital. I was born here in Tanzania, in a village called Mwanhala, Tabora, Nzega. And I left in 1997. I went to UK. When I was in the UK, I worked as a healthcare assistant, and I applied to study at University of Brighton. I became a nurse at the Royal Sussex Hospital. In the UK, we're very lucky because there you have everything. You have incubators, you have everything that you need. The resources are very limited here, very limited.
So in the West, if you have a premature baby, they're going to be in the neonatal intensive care unit, and they're going to have all kinds of technology and machines. And when you get to this kind of setting, you realize it's not feasible. We don't have the money for those kinds of machines. We don't have a constant source of electricity. So even if we have incubators, we can't be sure that they'll be on all the time. But then also we simply don't have the resources to fund that kind of care. And what I love about KMC is saying we actually don't need those things.
KMC stands for Kangaroo Mother Care.
And it's this idea, just like a joey, it spends a lot of time in its mother's pouch, that premature babies need to be close to their mother.
We encourage mothers to have as often as possible to have skin-to-skin contact.
Babies who are held skin to skin for the majority of the day, they don't get as cold, they regulate their body temperature better, they don't get as sick. As much as possible, exclusive breastfeeding. They also develop a bond with their mom, and they grow more quickly. So there's actually some really good research that babies who spend time skin to skin, so prolonged time, that the outcomes are just as good as if they were in an incubator.
Skin to skin, that's our incubator for these babies.
Sometimes in this setting, the child is born premature. The mother can be made to feel that it was her fault, that she was doing the wrong thing. Or if she loses a child, she's also made to feel like, well, she should just accept it because things could not have gone any other way. And when we care for small babies in a more traditional sense, in an incubator and in a NICU, we're taking the child away from the mother and we're saying, we're the ones who have to take care of this child. Clearly you can't. Whereas in KMC, we're saying, no, actually, you are the best thing that could ever happen to this child. And you know, if we provide the right setting and the right education and the support that she needs, actually, that she is the most important healer for her child. And I think that can give the mom a sense of power that I think goes beyond anything we can do when she's actually here.
HIPs have supported the locals by providing this beautiful building. They don't need to be transferred to another hospital, which it is not cost effective for them. Most of them don't have a high income to be able to travel every day. So the support they're receiving here locally is much better. These babies are fragile. They need to be protected from infections. Therefore, having their own room and restricted amount of visitors and having strict hand wash, it is important that we can minimize infection because that's the most silent killer for these children. KMC ward, currently we have 2 moms. One has twins and the other has just one baby. They're both doing very well.
The women have space to spread out. They can bring a relative in to help them with the care of their baby. And it's nice and quiet so that the babies really have time to rest.
Najisikia vizuri sana kuwa mama. Nampenda sana mwanangu. Lazima aletwe matibabu tujue ana homa.
These babies are usually preterm as well, so those things that develop towards the very end of the pregnancy are not fully developed, especially the lungs, so their ability to breathe and suck and swallow at the same time, so to get food is hard for them. And they have very little fat on their bodies, and so they get cold easily. And we know that with small babies, when a problem happens, it happens very quickly. So they go from looking normal to in serious trouble. That's one thing that keeping them longer in the hospital, we're able to follow them. And when a problem does develop, we can catch it much more quickly.
Tulikuwepo hapa na kitengo cha nini? Cha hips. Cha hips kwa kutuhudumia vizuri. Tunashukuru na tunapenda.
I think that it's really important to try to understand local culture for when we're working with local staff and also with patients. There's so much of what we can think is right or wrong that we think is maybe our training, but a lot of times is our culture. And so having that humility to say, okay, what is best for this place, not what is best in my own mind, but what is going to be the most sustainable, most beneficial for our patients, and that involves bringing in wisdom from local culture. So we found that as outsiders, we can come and say, you need to do this, but women don't respond as well to that as they do to a close friend or a grandmother figure or someone from their community saying, this is really what would be best for your child. And so this is our first week of starting this initiative, linking community health volunteers with KMC mothers. So we're heading to visit a mother and her baby who were in the Kangaroo Mother Care ward and now have been discharged. And we're going to pick up a community health volunteer who will be visiting her in the future as well, so we can kind of do the first visit together and see how things are going, see how the mom is and how the baby is.
Mimi naona kazi yako ni nzuri tu. Kwanza unajali jamii. Unajali mpaka watoto, unamjali mama mzazi ili asipoteze maisha yake, mama mzazi na mtoto.
We provide the community health volunteer with some basic training, and she'll visit her at home once she's discharged. to help her and encourage her to wear the baby skin to skin, to continue breastfeeding, and kind of walk her through all of the bumps along the way. When she's at home, she can feel equipped to be a good mother to her children and to care for them throughout the rest of their lives.
Mimi napenda jamii wasipate tabu, ili wale jamii niwe karibu nao kwenda kujisaidia kwenye hospitali, kuzalia kule hospitali. Napenda sana na kupunguza mama na wazazi, vifo vya mama na wazazi na watoto.
Nakumbuka tuliona kwenye video.
Nyembo na mtandea zogo.
Lakini kwa mtoto ukiweka karibu sana na macho, kwa sababu hatengenezi zile
kope zake.
I feel privileged to be able to live in the UK for 20 years as a nurse and coming back home to work here. I feel lucky. Not many people are able to experience both sides of the world, to see what Europe has to offer and what Africa has to offer. And I feel I've come back home this time to help this side of the world here in Tanzania.
Say hello.
I feel HIPS is really important here. HIPS are hands-on, working here as part of the family. It is something I feel that they're bringing the difference to the local communities. It's great, it's amazing.
One thing I love about HIPS is that they have a long-term vision. It's about walking with local staff, local doctors and midwives and nurses and saying, what are your needs? How can we come alongside you and help you? Because at the end of the day, it's the local doctors and the local staff who are going to be here. And I think they're the ones who can provide the best care.
Zainab was born last year. We're very lucky to have her still alive. She was very premature. Her weight was 900 grams, a very small baby. Therefore, she required a lot of interventions. She was taken care of skin to skin. She's now 10 months old. Her weight is still low, but she is improving. So we are seeing her on a regular basis. She still attends the clinic every Monday. Her mother is able to come and ask her for help anytime. Malnutrition is very dangerous because it is not something that some parents can see. So teaching them, explaining to them how easily they could lose their children, it is important. We also support them by providing milk.
Nilikuwa na wasiwasi wanamlizania hapo hospitali. Mmemsaidia kwa kumweka kifuani, kumfanyia kama kangaroo. Ndio wazo zuri, kwa sababu kama ndio ungekuwa hujamuweka hapo ndo pengine ungemkosa ama pengine kungekuwa na matatizo fulani. Lakini ile kumweka hapa uongo na wewe mwenyewe pia unajipa moyo.
I think if she was born in a rural area where there's no KMC, Zainab wouldn't be here today. She wouldn't be here. We're reducing the number of deaths. It is getting better and better.
To see now that actually our babies who are staying in KMC are getting the care that they need, the moms are getting the education, they're actually growing and thriving, and that's really exciting.
Jisikia raha.